care about. WLBB, Carrollton, News Talk 1330, FM 106.3.
As we journey through this global pandemic together, Oak Mountain Academy is lifting everyone in prayer and holding the community in our hearts. We continue to pray for all of the families directly impacted and the first responders and medical personnel on the front lines. There are so many individuals working around the clock to keep us safe and healthy. I'm Patrick Uran, headmaster, asking you to join all of us on the mountain in prayer and gratitude for everyone in our community. For more information about the Academy, visit us at oakmountain.us.
At Tanner, our heroes are fighting the COVID-19 virus around the clock, but you have an important job too, and it's urgent. Stay home.
We all must work together to stop the spread of the COVID-19 virus.
Staying home is the only way to avoid exposing your loved ones to this virus.
Each time you leave your home, you risk exposing yourself and spreading the virus to others in our community and in your home.
Do your part so we can continue to do ours. Stay home.
It can save the life of someone you love.
And good morning. Welcome to Community Voice. Today is Tuesday, April 14th. I'm your host, Josh Engel. Joining us on the phones today, maintaining that proper social distance, we have Dr. Richard Warren and Brooke Cronell. Now, Richard Warren is an emergency department physician at Tanner Health System. He oversees operations in the emergency departments at Tanner Medical Center in Carrollton and the Higgins General Hospital and Tanner Medical Center in Villa Rica. He's a board certified in emergency medicine. He earned his medical degree from the University of Florida. He completed his internship and residency in emergency medicine at Darnell Army Community Hospital. And Brooke Cronell, she is an emergency room nurse at Tanner Medical Center here in Carrollton. And she has been a nurse for 9 years and in the emergency department for 5 years. We are continuing our Tuesday program partnership with Tanner Health Systems to continue to keep our listeners informed on the current stage of the COVID-19 epidemic here in West Georgia and beyond. And we're going to be continuing that program today with Dr. Warren and Miss Brooke Cronell. Good morning. How are you both doing today?
Good morning.
Good morning.
Thank you very much for joining me. Why don't we just get right to it? Dr. Warren, New York and Italy are still struggling. How are the Tanner emergency rooms holding up? And what are some challenges that you are currently facing?
You know, it's been interesting to watch. If we look at our overall census in our department, it actually has gone down some. But what we have seen is that our acuity or the illness of the patients that we've seen has gone way up. In general, our department admits probably 15 to 20% of the people that we see prior to this. And at this point, it's closer to half the patients that come in are actually getting admitted and are ill. Our docs are holding up great. Our nurses are holding up great. We've got great support from the Tanner system, which has made everyone feel a whole lot safer. And obviously, the big thing people get concerned about nowadays, and they hear all the concerns about personal and protective equipment, but we fortunately have got a system that is protecting us very, very well.
Excellent. That is very good news in a time of very little good news. So thank you very much for that. Are there any particular challenges that you and the nurses are facing?
I think the uncertainty is the concerning part because, you know, in our setting, we still have the same people that come in with heart attacks and with strokes and with other illnesses. And, you know, the concern nowadays, and the truth is that so many people have been exposed, you just don't know exactly what you're going to get when you walk into any room. And I can tell you personally, and most of the docs and all of the nurses have kind of been the same way. We've gone from a place where we would protect ourselves with certain types of patients. We would be concerned about, you know, this one has a cough, so we need to make sure we have all of our gear on, to the point now that any patient we see, we assume that they're going to be exposed. And it's really changed sort of how we approach patients.
Oh, of course. I mean, I understand. In fact, you know, you touched on this briefly a moment ago, but first off, of course, it's definitely best to just be safe and assume that anyone and everyone could possibly have the virus. But, you know, I was thinking, earlier today, actually. I was thinking, an emergency room is already a somewhat stressful place. I mean, during normal times when you have folks coming in, with injuries and gunshot wounds or broken bones or whatever. So it's tough to imagine that on top of all of that, you have this situation that we're enduring now. So thank you for what you both are doing. I know this has to be very stressful.
It's a stressful time, but like I said, I think one of the great things about it is we've got and I've said this, one of the beauties of working in a community setting is that we have got a tight-knit group of people. We take care of each other. We love taking care of the community. So it's been a challenge, but I think that we've been set up from the very beginning to take care of things like this and to take care of each other.
Excellent. Now, Ms. Cornell, if you wouldn't mind, tell us more regarding procedure. So how do you intake or care for patients who have tested positive for COVID-19?
Well, of course, we're definitely taking extreme measures to protect ourselves and also to make sure that we're not infecting other patients. We're doing a lot of hand washing. We're using extra caution to make sure that we are protecting the patients that aren't sick so that they don't potentially catch the virus. And we're also making sure that we're keeping patients isolated. We're trying our best to keep them in certain areas if we can, and making sure that we're using constant hygiene. We're even doing social distancing at the nurses' station. We're not eating lunch together. We're not sitting close to each other. Even at the nurses' station, we're wearing our masks. We're also trying to protect each other.
For sure. And I know that adds an additional layer of stress for sure. Actually, you just reminded me, if you have this information, has there been a substantial amount of nurses and or physicians who have contracted the virus?
I believe that globally, yes. I don't know the exact numbers, but like Dr. Warren said, we're very well protected. We're being very cautious. We're trying to educate others about being cautious. We have a wonderful environmental services team that is constantly sanitizing, cleaning, not just for the patients, but for the workers as well. Of
course, yeah. Shout out to the sanitation team for everything they're doing. I know that has to be a lot of work. For sure. Well, we're going to take a quick break, but when we come back, we're going to speak more with Dr. Richard Warren and Brooke Cronell about how COVID-19 is impacting and affecting the emergency department at Tanner Health System right after a brief word from our sponsors.
At Tanner, our heroes are fighting the COVID-19 virus around the clock, but you have an important job too, and it's urgent. Stay home.
We all must work together to stop the spread of the COVID-19 virus.
Staying home is the only way to avoid exposing your loved ones to this virus.
Each time you leave your home, you risk exposing yourself and spreading the virus to others in our community and in your home.
Do your part so we can continue to do ours. Stay home.
It can save the life of someone you love.
As we journey through this global pandemic together, Oak Mountain Academy is lifting everyone in prayer and holding the community in our hearts. We continue to pray for all of the families directly impacted and the first responders and medical personnel on the front lines. There are so many individuals working around the clock to keep us safe and healthy. I'm Patrick Uran, headmaster, asking you to join all of us on the mountain in prayer and gratitude for everyone in our community. For more information about the Academy, visit us at oakmountain.us.
And good morning. Welcome back to Community Voice. I am your host, Josh Engel. Today is Tuesday, April 14th, and I'm having a conversation with Dr. Richard Warren and Brooke Cronell. Dr. Richard Warren is an emergency department physician at Tanner Health System, and he oversees operations at the emergency departments both here in Carrollton and in Villa Rica. And Brooke Cronell, she's an emergency room nurse at Tanner Medical Center here in Carrollton and has been a nurse for over 9 years and in the emergency department for over 5. We are currently talking about the COVID-19 pandemic that I'm sure you're all very well aware of. And right now we're talking about how that is affecting the emergency departments here in our local community. So, Dr. Warren, when should a person seek emergency care during this pandemic?
It's interesting. Through the Department of Public Health and the CDC, there's been some pretty specific guidelines. And we tell people, generally speaking, there's a large portion that will contract COVID-19 that will be asymptomatic. There's a large amount that will contract it and they'll have flu-like symptoms. And we tell people in general, if you feel lousy, if you feel like you have the flu, just in general, then the best thing to do is to stay home, socially isolate, and sort of more symptomatic treatment, which includes, just rest and fluids and the normal stuff that mom taught you when you were growing up if you had a cold. We get concerned if people begin having, severe shortness of breath is one of the big things. We've also seen with this disease a lot of GI-type symptoms, so the people that are unable to keep down fluids and feel like they're getting dehydrated, a lot of times it's a good idea for those people to get checked out. I can tell you that there are numbers of people that are testing positive that we are sending home, and a large portion of those people do absolutely fine. It's been as time's gone on, I think people have gotten more comfortable with that. Initially, when this whole thing started, anyone that tested positive assumed they needed to come in the hospital and stay in the hospital until it was gone. And like I said, we found a lot of those people have done well with home, just symptomatic care. I tell people in general in the emergency department, if you're concerned, that's what we're there for. That's our job. If you're feeling like you can't breathe, if you're feeling like you can't keep fluids down, you're getting dehydrated, then that's when it's time to seek more medical care.
For sure. And we actually have a question that came in on the Facebook live stream. It's from Bob Uglum. Let's see here. Can you update us on, let's see here. Well, I just lost it. Never mind. I just lost the Facebook stream. I was going to ask you some questions. We like to keep folks involved there. Now, so my next question, Ms. Cornell, what measures are being taken to prevent the spread of COVID-19 in the emergency room?
Well, we are, of course, washing our hands, using our social distancing. We are protecting ourselves, protecting our patients. We are also, we kind of look a little different these days. We're wearing masks constantly. We're covering our heads, using goggles, which is a little unsettling to some people when they come in and see us. We don't look like the traditional nurse that you're used to seeing. But we're trying also to make sure that we are isolating outside of work as well as while we're at work. So we're not going out. We're not, going into the community when it's not necessary. And we're trying to keep as many people safe as possible.
Excellent.
And I'll add to that. In the emergency department in general, we've divided it sort of into zones. We've got several areas that are what they call negative pressure rooms, which kind of keep that airflow from getting into the rest of the emergency department. We try to use those rooms with patients that we think are of high risk. We've got several of those rooms, and actually the group at Tanner has been able to turn several rooms over, and they have the capability to make even more of those negative pressure rooms. What we're able to do in those rooms is to isolate people. There's a big concern in the community if they break a bone or if something else happens to them, are they going to be safe coming in? And with these measures, people are still safe to come to the emergency department if they have other injuries. We would hate to think that there are people out there that have injuries or they have illnesses that needed treated, and they're afraid to come in and get taken care of because of this COVID. And that doesn't mean we want people, rushing in for stuff they think they can take care of at home. But if people feel they have an emergency, the setting up of the emergency department and the zones we set up are going to keep people safe.
Excellent. And that's honestly makes me feel a lot better knowing that those initiatives are being taken and are currently in place. So to prevent the further spread from folks who might just have a broken leg or something. Some regular run-of-the-mill injury. So I'm happy to hear this. But so as you said earlier, there's not a specific shortage of supplies, respirators, N95 masks. I'm not even sure if you've really had a great need for respirators, to be honest.
We use the topper devices, which when you see on TV, the people wearing the big hoods and things like that, we'll use those for certain procedures. But what we have found is that Tanner's done a great job of getting us equipment. There's also been a lot of research, nationally done to see how we can clean that equipment, which before this, it was never really done. We would just, if you used an N95 mask that everyone hears about, it would get used once or twice and just thrown in the garbage. But fortunately, through research, and it's being a pandemic such involved the entire nation, they have had researchers look into these things. So we have a system now where we take those masks after we use them once, and we put our names on them, and we put them in bags, and they get sent through EVS, and they get cleaned so they can be reused several times. And it's allowed us to have enough equipment. I had to use one of those hoods a couple times last night on my shift, and we've got 3 or 4 of them in the department. And I was able to send them down and have them cleaned, and they were back within an hour and a half to ensure that we have a constant turnover of that equipment when we need it.
For sure. This is something that has been on my mind for some time now, and I wanted to ask you specifically, how has this epidemic impacted you as a physician, and you, Miss Cornell, as a nurse? How are you taking care of yourself, and how are you making the most of the free time that you have?
Brooke, you want to start that one?
Oh, sure. Well, it has been definitely a change. We decided a few weeks ago that my children, my husband is a deputy for Carroll County, and so he's still working as well, and we knew that we would, both be exposed, especially me exposed constantly, and my parents are our child care. So we decided that the safest thing for everyone would be for our children to stay with my parents, so that we're not spreading germs to them. We know we have to keep the community safe, and that includes our family. It's been definitely more challenging than we expected. It has been a long 3 weeks, and we're just trying our best to stay positive, trying our best to make sure that we're protecting each other, and trying our best to stay connected with our family. Everyone has a different situation, and we all have families that we're trying to protect. And at the end of the day, we just have to make the decision that's the safest for all of us.
Of course, and I know that that has to be unbelievably difficult, having to keep your children separated from you right now.
Yes, sir. It has been amazingly difficult. I've missed their birthdays. We missed Easter. But once again, we have to stay strong. We have to know that we're doing the right thing, and know that we're doing the safest thing.
Of course, for sure. Just my wife this past weekend, she was talking to me. She was like, she's 31, by the way. She's like, in 31 years, I have never, or at least 30 years, I've yet to have an Easter not at my family's church back home. And it just took a lot out of her, I guess, emotionally knowing that, there's no way that there's no way you can just live a norm. Things just can't be very normal right now, considering the situation. How about you, Dr. Warren?
It's interesting. I always kind of see it as, I was military, and I see it a lot like military deployments. The only thing that makes it harder when you were deployed there was really no way to see family other than FaceTime, or then at that point it was phone calls and that sort of stuff. Knowing the people right around the corner and you still can't have contact with them and see them, it gets very, very tough. I can tell you that I've spent a lot more time outside. I stay at home, and obviously we stay in different rooms at times. There's a lot more that goes into coming home than it used to be, where we change out and shower at the hospital, and then we come back home and get around family. But I think it's going to be interesting, and I think church is an interesting thought process, because we felt the same way when we couldn't go to church. But I kind of feel like that all these things in the end will make us stronger as a community. I think it makes church families stronger. I think it's tough and it's trying at times, because everyone is so used to running and going, but I think we're going to appreciate each other, appreciate what we have a whole lot more coming through this whole thing.
Very refreshing to hear you say that. And I agree, truly. And I think a lot of folks listening agree, too. I mean, if anything, this gave us an opportunity to stop and take a breath and remember what matters most to us. It's definitely helped us prioritize things. And it just goes to show how important it is, as far as getting groceries and whatnot, considering what you risk by going out and getting some. I did get that question brought back up here. Thank you for all your efforts. Can you update us on how the testing process works? That was a question from one of our listeners. And also there are lots of comments that are coming in on the live Facebook feed. So if you're tuning in, be sure to check out the live Facebook feed as well. A lot of folks saying thank you so much for your sacrifice. Good news, wonderful news, and thank you for all of your hard work. We definitely have a community here that supports both of you, everyone that's involved in the health system, and all that you're having to sacrifice and what you're having to do. So thank you so much for what you're doing, and I wanted to let you know that that's what folks were saying. So yes, back to the question. Can you update us on how the testing process works?
We still have a fairly robust testing process. In the emergency department itself, we kind of follow CDC guidelines for testing, which means that we test people that are healthcare workers, people that are in jobs where they're exposed, like nursing home workers and hospital workers and police department. We test people that we think are going to get admitted to the hospital. So it's a little bit stricter guideline as to who's tested in the emergency department. There are still a lot of the Tanner docs are testing a few more people, and testing is a very, very important thing. At this point, Tanner's done more than 2,000 tests. I can tell you that there have been within the Tanner system about 300 positive tests, and this was the information as of yesterday. There are still lots out there, and you have to remember there is a false negative rate to this test. So there are people that will test negative that if you test them again would be positive, and has to do with collection and just the test in general. I think what we're going to find as time goes on, though, with some of the more rapid fire testing, that testing will ramp up. I think that more people will have it done. We generally tell people at this point that if they're going to come through the emergency department, we're going to look at those guidelines to determine who tests and who doesn't test. And just because you were necessarily exposed to someone doesn't mean that you'll require a test to the emergency department.
For sure. So that's good information for everyone listening. I'm making like a mental checklist of all this info. We have a question that came in here from Carolyn Minter. She's asking on the Facebook live feed, at how much risk is at how much of a risk is someone that is diabetic and obese, along with having to be on Humira, which lowers your immune system?
Anytime that you are have what they call comorbid disease, so when you talk about coronary artery disease, you talk about lung disease, whether it be COPD, emphysema, asthma, anytime you take and they talk about cancer patients when they talk about immunosuppressed, but any of those chronic steroid type patients are going to have a level of immunosuppression. They are at bigger risk. Those are the people that we say, look, the less you're out, the better. Those are the people that, for our church, for instance, we say, look, we're going to the grocery store, what can we bring you? They are no doubt at a higher risk.
For sure. Excellent. So let's go back to Ms. Cornell. So I have a question here. We only have probably about 3-4 minutes left. Actually, we have a little bit more time than that, which is great. So I wanted to ask you words of wisdom that you possibly would like to bestow upon our listeners. Tips, advice, anything that you would like to let folks know that has maybe been on your mind, and maybe it's something that hasn't been asked yet.
Of course, we want to remind everybody to wash their hands, use good hygiene, practice social distancing. Please stay home. Don't leave your house unless it's absolutely necessary. We really feel like that's the best way to protect the community. And I think I can speak for all of us at the hospital when I say that we're absolutely blown away by the community support, their encouragement, the prayers, sewing masks for us, donating supplies. Most days we're being fed by businesses or individuals in the community. Every day we drive to Tanner, we see the streets lined with red ribbons. We just I can't put into words how much the community support means to us. And we are so thankful for that. I think, this is kind of an emotional roller coaster, and every day I've received some type of encouragement, whether it's from someone in the community, someone else that I work with at Tanner, just to help us keep going, and we appreciate that. And we're so thankful for our community because this is our family. And I'm also just, so thankful for everyone at the hospital. Everyone has really come together as a team. We have an amazing director that cares for us, not just professionally, but also personally. And the teamwork that we've had has been amazing. So I guess I'm very thankful, and I feel very blessed. So
that's very beautiful. And honestly, to piggyback on what you were saying is like what Dr. Warren was saying earlier. It really this has really gave us a moment to breathe and sort of prioritize and put everything in a different perspective. And you really are seeing the best of the community coming out when this is happening. I think that folks' go-to fears are that they're going to see the worst. You see a little bit of that. People were hoarding supplies up at the beginning and whatnot. But you're really starting to see. Those red ribbons on the street are really having an impact. And I'm not a health professional, so I can't imagine how that impacts you and your team, knowing that you have a community full of people that love you and support you and appreciate what you guys are doing on the front line of this war, essentially, against COVID-19. Now, Dr. Warren, same question to you. Words of wisdom that you would like to give to our listeners, anything that possibly you haven't been asked that you would like to get out there, information, whatever you would like to tell our listeners.
I'd like to mirror what Brooke said. First of all, the community support has been absolutely amazing, and you don't realize how much it's appreciated. There are notes plastered on the wall, just thank you notes and things like that. And I think that I feel this way. Our nurses and our EVS staff, they work so hard and they're so underappreciated. I feel like that the docs are the ones that get the pat on the back, and I'm going to tell you the lion's share is carried by our nursing staff, by our EVS, by our food service people, by all the people that keep that hospital running, and the community support to them, and the showing of love that they've received from this community has been absolutely amazing. And the last thing I would add is don't get complacent. I think that what concerns me the most is when this started, we had people that they were bought in. One person went to the grocery store for 4 households, and everybody stayed in the house. And I think the longer this goes, and the more you hear about how we've kind of reached our peak, and the curve is flattening, and things are getting better. I know that everyone's anxious to get out and see their friends and to get back to a normal life. But I kind of look at it like this: we're getting close to the fourth quarter, and we're winning the game. Let's not let it go. Let's stay in it, and let's not get complacent, and let's continue to do the things we're doing that are helping flatten this curve. And I think that's what's going to get us through it. It's a war, and I feel like that our community is doing a great job of winning that war. I don't want to see us back off when we can see the finish line.
Exactly. I love that analogy, comparing it to a game of some sort, like a sports game. We're in the third quarter here and we're doing good. So let's not just walk off the field and, go get something to eat and to celebrate. We haven't won yet. So that's a great piece of advice. Don't get complacent. Let's keep doing what we can to flatten that curve. We only have a couple of minutes left here, but I wanted to ask you, Dr. Warren, what are your feelings about the future? Where do you think that we're going to go from here, especially when it comes to the emergency department?
I think it's going to be interesting to see how all this plays itself out. I would like to think that there'll be a combination of, hopefully a vaccine in the near future, as well as some herd immunity. I think there'll be some bumps in the road continuing. I think even when we think all this is over, there'll still be some flare-ups, and I'm expecting that. I think from an emergency department standpoint, I think we're learning a whole lot about ourselves through this. I see people coming back to the emergency department. I see our numbers going back up, but I don't think it's going to be the switch comes back on and we just spill back up. I think that people have had this serious health scare, and I think that it's gonna change how we take care of ourselves. At least I hope that it does. But I don't think that just because we're seeing the flattening now it's over, and I don't want people to get discouraged when there's bumps in the road, because I feel like there will be.
For sure. So everyone, let's keep our heads up and stay optimistic, stay positive, stay focused and proactive. Stay in your house, and let's help flatten the curve. Dr. Warren, Ms. Cornell, thank you both very much for joining me. I know this is kind of awkward, doing this phone stuff, but you guys did great, and thank you for always being willing to bring such vital information to us and our listeners every week here on a Community Voice. Thank you both very much.
Thank you.
Thank you.
All right, and we'll see you next time. Tune in tomorrow for Community Voice. Have a great day.